Hello guys, welcome to my YouTube channel Learn with Dr. MSK. Today I'm going to explain about the enteric fever, also known as typhoid fever. See, according to university purpose, we have two types, viva and theory. So in viva, what are we going to ask? The principle of Vidal test, when it is done, and what is the infective dose, and what is the lab diagnosis, what are the cultures, what are the specific medias, and what are the clinical features, etc. They are going to ask in the viva. Okay, next in theory, what are they going to ask? They're going to ask lab diagnosis, Vidal test, and etiopathogenesis, clinical features, treatment, and write about the enteric fever. Okay, these are all the questions going to be asked. Okay, let's discuss what is meant by a typhoid fever. Okay, it is one of the most common and it can be repeated in medicine. Let's learn. See, enteric fever or typhoid fever. So what is a typhoid fever? It's a multi-system illness. Okay, why multi-system illness, sir? There is an involvement of CNS, involvement of GIT, and involvement of skin, and etc. Okay, this is called multi-system illness. Okay, next, sir, which organism is going to cause the typhoid, sir? Salmonella typhi and Salmonella paratyphi A, Salmonella paratyphi B, and Salmonella paratyphi C. These are the organisms that are going to cause the enteric fever. Okay, sir, what in the Salmonella typhi, they exhibit antigens. Okay, they exhibit three types of antigenic structures. What are there? Somatic antigen, sir, flagellar antigen, sir, and surface envelope antigen, sir. Let's discuss about the somatic antigen and flagellar antigen side by side. Okay, so what is a somatic antigen, sir? It is a part of the LPS, lipopolysaccharide. Okay, sir. What is flagellar antigen, sir? In the Salmonella typhi, then there is a flagella. In this flagella exhibit an antigen called as H antigen, sir. Okay, sir. Which is more immunogenic, sir? It is a H antigen is more immunogenic. Suppose an O antigen react with the O antigen of Salmonella typhi react with O antibody. O antibody form antigen antibody. Okay, after formation of antigen antibody, if it is O antibody, if there is formation of antigen antibody reaction, there is a formation of compact granular chalky clumps can be seen. Okay, sir. What about the H antigen, sir? When H antigen react with H antibody, there is a formation of antigen antibody reaction, sir. Okay, sir. And after the antigen antibody reaction, how can we observe, sir? We can observe large, loose, and fluffy clumps, sir. See, large L. Okay, large, loose, fluffy clumps. Okay, sir. Okay, sir. This is process called as agglutination, sir. This process is called agglutination, sir. Next, at optimum temperature when it done, if it is O antigen, it occurs at 55 degrees. If an H antigen, it occurs at 37 degrees. What is mean by optimal temperature? Optimal temperature, at that temperature, the maximum reaction can occur. Simply, okay. Do you understand it? Okay, let's go to the next. Okay, right. Next, okay, sir, what is a surface envelope antigen, sir? The same thing. If it is one capsular antigen, simply if it is in a body of Salmonella typhi, it is a flagella exhibiting and okay, appendages, pili, etc. are going to be there. See, this is in a capsule. Okay, this is called a surface envelope. Okay, it exhibit O antigen, sir. Okay, outer covering of this O antigen, there is one more antigen. It is called as surface envelope antigen, sir. Okay, sir, is it helpful in the diagnosis of the Salmonella typhi, sir? No, sir. Why, sir? Why Salmonella surface envelope antigen is not used so helpful in the diagnosis, sir? So if it is an antigen, it is an antigen. When react with an antibody, there is a formation of antigen antibody reaction, and we detect the titer means simply the concentration of antigen antibody or antibody reaction of the sera. Okay, we are going to measure. If we are going to measure that one, their antibody titers are low. If there is a real infection also, antibody titers are low, there is a mistaken as a chance of, oh, here this patient doesn't have a Salmonella typhi. Okay, that's why we are not using in the Vidal test surface envelope antigen. That's clear. Okay, and let's get into the another thing. Okay, Salmonella typhi, how it came, sir? How it will come? How will it going to infect? It will going to infect through contaminated water and food. What is an infective dose, sir? Infective dose, it's a minimum dosage of a bacteria. It's a minimum concentration or minimum dosage of the bacteria to initiate the infection. That is the minimum dose. It's called as minimum dose. Okay, the minimum dosage of the Salmonella typhi is 10 power 3 to 10 power 6 bacilli are required to initiate the infection. Okay, sir. What are the risk factors? The risk factors are stomach acidity and the loss of intestinal integrity, sir. Okay, sir, why is the stomach acidity and the loss of integrity is contributing in the Salmonella typhi, sir? So as we know, the stomach, imagine the stomach, it produces an acid. Acid is a physiological and chemical barrier, so that it doesn't get bacteria. Enter into the further GI. Okay, it can destroy the bacteria here itself. When HCl is low, or any infection leads to decrease in the HCl concentration, there can it can bypass there can it can bypass the there can bypass the there can bypass this mechanism and enter into the GI, and it can cause the infection. Okay, sir. Okay, where can we see in, sir? This can be where we can see in the achlorhydria and H. pylori infection. Achlorhydria means what, sir? Achlorhydria means there is a less production or less quantity of the HCl is produced. In this condition is called as achlorhydria. Okay, and H. pylori infection and loss of intestinal integrity, sir. Why loss of intestinal integrity contributing the salmonella typhi, sir? Again, simple, sir. When irritable bowel disease, IBD, causes the loss of intestinal integrity, leads to perforation and damage lead to and further entry into the GI system. There can it can bypass it can cause the infection. Okay, cause the infection. Next, sir, what is the next why suppression of GI flora by antibiotics, sir? Suppression of GI flora by antibiotics is mediated. If you go to a doctor on a, and it was a patient, sir, I have an infection, so doctor prescribed the antibiotics. Okay, sir, doctor prescribed the antibiotics. So the patient think that indiscriminately, when the patient uses indiscriminately without the advice of the doctor, it can land up. This is the gut, and this is the gut. There is, when you take indiscriminate amount of, means heavy amount of antibiotics, there is a suppression of GI flora. GI flora normally contributes the immunity of the gut health. Okay, when the suppression of GI flora inhibited, so there is a chance of infection. Okay, this is the simple thing. Okay, next what we are going to do, what about the etiopathogenesis? Next, etiopathogenesis of the salmonella typhi, which is cause the infection. Okay, next next we need to go further and change. Okay, suppose this is a gut flora. Imagine this is in a GI. These are the cells. Okay, so somehow I was entered. Somehow salmonella typhi is entered. Okay, this is the salmonella typhi entered into the GI. Okay, sir, after GI entry, they go into this is called as M cells. This is called enter into the M cells, and they form the membrane ruffles. Membrane ruffles means just like this. Membrane ruffles. And after formation of membrane ruffles, these bacteria go and these bacteria, salmonella typhi, go and attach to the M cells. Okay, sir, after attachment of M cells, they are next. These are engulfed by a large vesicle called as through bacteria mediated endocytosis. Okay, sir, the process of uptake of the bacteria into the large vesicle is called as bacteria mediated endocytosis. Okay, sir, who is gonna control it? Who was going to be mediated, sir? It was mediated by the type 3 secretory system, sir. Okay, sir, next, what is the entry base? Next, after entry into large vesicle, they cross the epithelial barrier and reach to the submucosa, and there they are phagocytosed by the macrophages, and these macrophages lead to the spread and enter into the lymphatics, and thereby enter into the bloodstream. When first time bacteria entering into the bloodstream, it is called as primary bacteremia. Next, these infection spread towards the reticuloendothelial system, gallbladder, kidney, lungs, etc. organs. Okay, means reticular system include the liver, spleen, etc. Next, gallbladder, kidney, lungs. These are going to spread the infection to these organs. After the spread, there is a local infection. There going to be multiplication in the organs. That is called as seeded organs. There is a local multiplication of organism through the local organization at the site. Okay, that is called as seeded organs. Okay, next, after the seeded organs, the infections are in bacilli are going to be present like these clusters, and infection present in the organs, and these again come into the blood as a second time. This is called as secondary bacteremia. After coming into the blood, they cause the symptoms, signs and symptoms. Okay, sir, one of the very important slide here is going to be, sir, when you observe the patient, there is a rose spots on the chest and the trunk. It contributes about 30% of the chest, and 30% it can contribute just along the chest and the trunk. Okay, this is called as rose spots. And how the fever is going to be stepladder type of fever. What is the characteristic of stepladder fever? It was rise and fall, but doesn't touch the baseline. Okay, next, when you see the CNS manifestation, what are the CNS manifestation? You can use the direct mnemonic as MCH, called as meningitis, cerebral ataxia, headache. It is a hepatosplenomegaly can be seen, and GA bleeding can be seen, and intestinal perforation means like puncturing hole. This is an integrity, and this is called puncturing. It's called as perforation means hole. Next, one of the common is nausea, vomiting, abdominal pain can be seen. Next, what are the laboratory diagnosis is one such important thing. See, let's see. Laboratory diagnosis include specimen of collection. This, which sample or which specimen you need to collect. If it is was a first like if it was a first week, you need to you need to go for blood culture, bone marrow culture, and duodenal aspirate. Okay, best. Then the next we are going. If it was in the second or third week, you can go for the serology test like Vidal test. Okay. Next, if it was infection was third and fourth week, is you can go for the best urine and stool culture. Next, we are going to identify the culture and identification system, blood culture, stool culture, and enrichment and selective media. Here, I want to make a statement that it is a 5-star and important. It was a 5-star and important for Viva and MCQ in theory. Okay, MCQ and in theory. So, what is a blood culture, sir? Blood culture system, sir. It is an ideal method of diagnosis in the first week. Okay, na? Next, first collection of the blood, sir. There is a 8 to 10 ml of blood we need to collect. In which we are going to collect it. We are going to collect 8 to 10 ml of blood in the blood culture medium. What it contains, brain heart infusion can be a monophasic, or monophasic means any one state, is a liquid or a solid. Okay. Next, biphasic means there is an agar, or agar means solid media, and then the liquid media. Or biphasic or monophasic media you can be used, and we can innovate at 37 degrees. Okay. 37 degrees for 24 hours. Okay, that is it. How the colony going to appear? If we culture in the blood agar, it shows the non-hemolytic moist colonies can be seen, and if it was a meconic agar, it is used and round, translucent, pale, and non-lactose fermentings. Simply you can use non-hemolytic moist colonies can be seen on the blood agar. Next, in meconic agar, you can use the non-lactose fermenters. Just pale non-lactose fermenters you can use. That's it. Okay. Next, stool and urine culture. Stool and urine culture, when it is useful, as we studied in the third and fourth week of the illness, we are going to use as a sample, stool and urine culture. Okay. Next, enrichment broth. See, there is an enrichment media and enrichment broth. See, simply there is a two days. In enrichment media there is a solid as a medium. Okay, in enrichment broth there is a liquid as a culture. Simple, that's it. Next, enrichment broth low, selenite broth, tetrathymine broth, gram negative broth. These three are very important for the diagnosis. Very important. They can be asked as a viva and they can be asked in the MCQs. Okay. Next thing, what is a selective media? As I said, it can allow specific type. It can allow specific type to grow, and inhibit or suppress the commensals. What is mean by commensals? Commensals means other bacteria that are not desired to grow. Okay. Suppose I want to grow the Salmonella typhus, and there is a presence of lactobacillus and etc. So I'm going to suppress the other bacteria, and I want to grow Salmonella typhi. That is called a selective media. Okay. What are the selective media available? DCA, XLD, and you can use the Wilson Blair medium directly. Okay. That's going to be DCA, deoxycholate citrate agar, and XLD, xyloslicin chocolate agar. Next, in DCA, we are going to see the pale colonies with the black center. In case of XLD, there is a black center. There is a black center, and it was covered by red color colonies. With the black center. Here, pale colonies with the black center. Okay, this is the simple. If a sample has high contamination or bacterial load, we can go for the Wilson's Blair to detect. Next, that's it, simple. Next, we can go for the culture smear and motility testing. If culture smear and motility testing, we are going to do gram staining. Okay, sir, I done the gram stain. What did I give, sir? I got the gram negative, sir. Okay, sir. So Salmonella typhi is a gram negative, sir. Okay. Is it sporing or not sporing? It is not sporing, sir. Is it capsulated or non-capsulated? It's non-capsulated, sir. Okay. How do you identify? It is a Salmonella typhi or not? Salmonella typhi or not? Sir, I can use a conventional biochemical method or automated method, sir. Sir, in automated identification, what, sir? Automated identification. These are the automated identification system. If you give the sample to this instrument or a machine, it can detect, sir. It is a Salmonella typhi or is a Salmonella paratyphi, sir. We can going to detect the organisms directly. In conventional biochemicals, we apply the test to detect whether organism belongs, or what we expect is correct or not. So for Salmonella typhi, catalase is positive, very important. This statement alone is very important. Catalase positive, oxidase negative, citrate negative, indole negative, and triple. You can use the different mnemonic cocky T. See, cocky T. Matlab catalase, oxidase, citrate, indole test. First one is positive, next all remaining is negative, and remaining is triple sugar ions alkaline by acid, but and it show gas, H2S, gas is produced. Okay, that you can use the method. Okay, one of the most important questions, sir, what is an Vidal test, sir? When we are going to do the serology test, this is we can going to be done in the 2 to 3 weeks of illness. Sir, what is the principle? You can learn it directly, and see we are going to apply, and we need to do. I will explain the simply. Okay, simply see, and just remember the thumb rules. Okay, now they are not exactly. Just remember the thumb rules. Okay, this is the Salmonella typhi. Okay, and this is the Salmonella paratyphi A. Okay, and this is the Salmonella paratyphi B. Okay, sir. See, Salmonella typhi exhibit two types: Salmonella typhi O antigen, H antigen. Okay, sir. Next, Salmonella paratyphi exhibit O antigen and what is called H antigen. Okay, and O antigen, H antigen. Or it also exhibit O antigen and H antigen. Okay, simply clear. Okay, next. Suppose we are going to use in Vidal test. If we are using O antigen with is called as TO, with H antigen called TH. Okay, simply. Next, same case when we applied in the Vidal test, apply the just T in the Salmonella typhi. This is called as T. Next, as we know, it is Salmonella typhi in T. It's called TO. Next, when the T and H, sir, already TH has been taken. How can we apply the TH? So in the T in the place, you can use A, called as AH. Okay. Next, same in the place T first. TO, sir, and next, so T are already taken, and we can use the B speech. This is the simplest and one. This is the just thumb rule I'm saying. You can remember this one of the you can use. Okay. See, O antigen of Salmonella typhi is see, O antigen of Salmonella typhi TO. Okay, O antigen. See, O antigens of Salmonella typhi TO. Next, H antigen. See, H antigen of Salmonella typhi is TH. Next, H antigen of Salmonella paratyphi A is called as AH. Okay. Next, H antigen of Salmonella paratyphi B is called as BH. That's it. That's the simplest. O antigen is referred in all in the same sense. It is Salmonella typhi or Salmonella paratyphi A, Salmonella paratyphi B, or Salmonella typhi. Okay. This O is the common antigen. Okay. You can use. And H antigen changes. Okay. That's why we are applying this. Remember, it is this thumb rule. Okay. Next, what is the principle, sir? How it was going to? When we see, simply, we need to take the patient serum. We are collecting the patient serum. After collecting the patient serum, we need to take the four test tubes like this. Four test tubes we are going to take in. We need to take in as a control, and other remaining as a test and control. Okay. What is meant by test and what does mean by as a reference? As a reference, we can less control, and it is called as test. It is called as control, and these are the tests. These are the four tests. You are taking in after taking the patient serum. You are serially diluting. Okay. See, if you dilute 1:20 and double it, 1:40 and double it, and 1:80 and again double it, 1:160, 1:3, 320, 1:640. After serial dilution, you can get, and you are going to add, TO, TH, and AH, BH. Okay, these are going to be added. After going to add it, you can incubate at 37 degree for 24 hours. As we said previously as well, we are going to add force at 37 degree for 24 and liquid for the control and the test. After this, what are the results we are going to be expected, sir? See, when simply remember, this is the one such an important patient of initially concern. This was an O antigen react with O antibody, form antigen antibody reaction. So when O antigen react with O antibody, we have previously known it can cause compact, chalky, granular clumps can be seen. When H antigen react with the H antibody to form antigen antibody reaction, form as large LL. Okay, large loose fluffy clumps can be seen. Okay. Next, if agglutination doesn't occur, this is the process called as agglutination. If this agglutination doesn't occur, there is a formation of deposition of antigen can be seen. Okay, that is a simple thing. Okay. If agglutinins, what do I mean by agglutinins? Agglutinins means simply by, as we know in the physiology, it is antibodies. Okay, these are the antibodies. If O antibodies appear early, it is appear early and disappear early. This indicates the presence of recent infection. Okay. H antibody appears late and disappears late. This can indicate the period of convalescence period. What are the molecular methods, sir? We can use a PCR. What type of PCR, sir? Nested type of PCR can be used. And how do you interfere, sir? Sir, as we know, in Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B. So what are there? As we know, TO and TH are elevated. TH are elevated in Salmonella typhi. If TO and AH are elevated, it is like Salmonella paratyphi A infection, sir. If a TO and BH are elevated, sir, it is the Salmonella paratyphi B infection, sir. That's it. That's the simple. TO, TH are raised, they are Salmonella typhi. That's the simple test. Okay, there is a false positive test and false negative test. Okay, sir, what is meant by false negative, sir? Sir, false negative means there is an actual infection, but the test doesn't show. Test is negative, but the disease is positive. There is a disease positive, but the test is negative. Test is showing negative. Why? It is an antimicrobial condition. So as I said in the previously, so we are going, when the patient use the indiscriminate usage of antibiotics, it can suppress the flora. So thereby can alters the levels of the titers. Thereby can show the false negative. Okay, what is meant by false positive, sir? What is meant by false positive? Here disease is negative. here this is negative simply. Okay, the test is showing the positive. Sir, ऐसे कैसे हो सकता है sir? Simply if the test is positive and the disease is not there, so where can we see? And it is this is the type of anamnestic response. Anamnestic response, it is, what is mean by anamnestic response, sir? There is no particular type of infection, but it can rise due to the other infection. It can be raised due to the other infections, not because of these particular infection. Okay, simply. Next, what's the treatment, sir? One such an important thing, the treatment is, you can use the third generation cephalosporins. You can use the third generation cephalosporin, sir. What is ceftriaxone? It is a drug of choice. And always remember, as for typhoid, you can give the ceftriaxone is must. It's because it's a drug of choice. How general, 1 to 2 grams per day. You can also give administered as IV, and duration is 10 to 14 2 weeks. Okay. Next, azithromycin. When you can use the most commonly used antibiotic, azithromycin, and it can be given as orally 1 gram per day, and duration you can be 5 days. In fluoroquinolones, ciprofloxacins, you can be given when, if only when strain is confirmed susceptible due to high drug resistance. Okay.